The Los Angeles County Medical Examiner concluded that sleep apnea and other undetermined factors contributed to the death of actress Carrie Fisher in December. The autopsy showed that she had cocaine, heroin, methadone, and ecstasy in her system. While the Star Wars actress was very open about her battle with addiction and mental illness, it's unclear whether she knew she had sleep apnea or if she was being treated for it.
Dr. Andrew Stiehm, a sleep specialist at Allina Health, is here to discuss the dangers of sleep apnea and how it may have contributed to Fisher's death. Thank you so much for coming in.
Thank you for having me.
So let's just start for people who might not know. What exactly is sleep apnea?
Sleep apnea means not breathing at night while you sleep. It affects about 9% of men and about 2% of women.
And one of the symptoms of it is snoring. So if you maybe have a partner who does snore, is that something that they should look into?
Most snorers just snore, but it's about 40% of snorers that have this disease, sleep apnea. So it becomes one of the first warning signs people should pay attention to.
What are the other warning signs?
There are complaints that the patient themselves will exhibit, and the main one being my sleep quality isn't what I think it should be, meaning I get 8 hours of sleep, but I don't feel like I'm getting 8 hours of sleep, or I feel like I'm waking up all the time, or I'm a light sleeper. So that's what the person has. What the person laying next to you will report is that you snore, and usually like I can hear you in the next room kind of snoring, and also that you stop breathing. You know, so I watch you sleep and there's this rhythmic snoring, and suddenly there's a pause, and then usually a kind of snort. Good for TV.
And Fisher had an extensive amount of different kinds of drugs found in her system. So can that play a role into how you sleep if you do have sleep apnea?
Absolutely. Both heroin and methadone would be things that could worsen sleep apnea. So the fundamental problem with sleep apnea is your throat gets so relaxed when you sleep it actually closes. Medicines like heroin and methadone will make you more relaxed and can result in a worsening of that narrowing.
Can sleep apnea kill you, or does it trigger something else in our bodies that is deadly?
Sleep apnea more triggers the other thing. And so patients with sleep apnea have about 3 times the death rate when it's severe sleep apnea, 2 to 3 times. Most often it's stroke and heart attack because sleep apnea contributes to coronary disease and cerebrovascular disease. Then when you're actually having an event in the middle of the night, it can be the thing that sets the heart off.
Okay, so what is your recommendation for maybe someone who might think that they have sleep apnea?
People put this off. They're afraid of the test, they're afraid of admitting to themselves they have a problem, and they don't often realize the severity. I mean, this is a disease that kills. So I think there are a lot of people out there whose spouses are telling them, you don't breathe well at night, you snore a lot at night, and they're putting off telling their doctor or coming to ask for help. I would just say come and ask for help.
Because there is treatment.
Absolutely.
All right.
They're also very much afraid of the CPAP, that mask that people wear. And so the other bit of advice I give you is we have a lot of therapies besides CPAP. We have mouth guards, we have surgeries, we have simple nighttime positioning therapies we can employ.
Good to know.
That's great. Thank you, Dr. Stiehm. Thanks for
pleasure.
coming in.
Thank you.